Hi, good morning, everyone. Thank you for being here today. My name is Mitzie, and as you know, we will be teaching you about glaucoma. But first, we would like to find out what you already know. So here is a short test for you to answer. They are all multiple choice or true and false. Number 1, what causes glaucoma? Number 2, glaucoma is reversible. 3, tunnel vision is a symptom of advanced primary open-angle glaucoma. 4, which type of glaucoma is considered a medical emergency? And 5, how can I prevent vision loss from glaucoma? Please just answer these to the best of your knowledge. It's okay if they are not all correct. And hopefully throughout this presentation, we will be able to give you the answers to the questions.
Hello everyone, my name is Gloria Olvera, and like Mitzie said, today's presentation is going to be all about glaucoma. So what is glaucoma? Glaucoma is a group of conditions that cause damage to the optic nerve. The damage is caused by increased pressure in the eye. So usually normal ranges of pressure in the eye are from 10 to 21 millimeters of mercury, and anything greater than 21 is considered ocular hypertension. If this condition is left untreated, it can cause irreversible or permanent vision loss, and it can also affect one or both eyes. So some causes. What causes glaucoma? Blocked or restricted drainage in the eye. So this is when the aqueous humor, or the clear fluid that fills the space in the front of the eyeball between the lens and the cornea, this is when it cannot drain out properly, thus increasing the intraocular pressure. Another cause can be some medication. Some examples are antidepressants, antihistamines like seasonal allergy meds, or drugs that dilate the pupil. Another factor or another cause can be genetic predispositions, and this is when glaucoma runs in the family or there's a history of glaucoma in your family, then you are more likely to develop it. And there's also blunt or penetrating injuries. This can be from contact sports like boxing, baseball, football, or any type of injury that is to the head or to the eyes. And then age is also another factor. So anybody over the age of 60 is higher risk for developing glaucoma. So diagnostics, how is glaucoma diagnosed? So physical examination or eye exams, a tonometry test which measures the intraocular pressure, or a visual field test, and this is a test that examines or checks the central and peripheral vision of the patient. And there's also a gonioscopy, which examines the anterior part of the eye, an ophthalmoscopy, which examines the back of the eye, and a slit lamp microscopy, which is illustrated in the little picture to the right. And then prevention is annual screening and recognizing disease in early stages.
Hello, my name is Miranda, and I'm going to be speaking on angle closure glaucoma. Angle closure glaucoma is caused by the lens bulging forward due to the aging process. It can occur during pupil dilation when a patient already has narrowed angles. As you can see in the picture below, that the angle is narrowed because of the lens bulging forward. This causes the fluid to build up and the intraocular pressure to rise. Now to the next slide. The symptoms of angle closure glaucoma occur rapidly and suddenly. They include headaches, intense eye pain, nausea, halos seen around lights, and blurred vision. It is urgent to see your doctor immediately if you begin to experience any of these symptoms. Here are a few treatments that can help by lowering the intraocular pressure. Miotic medications such as pilocarpine help improve the circulation and outflow of the aqueous humor. Some surgical treatments include laser iridotomy or surgical iridectomy. These procedures are similar, but one uses a laser and the other makes a surgical incision. These treatments are necessary for long-term prevention They allow the aqueous humor to flow through a newly created opening in the iris and into normal outflow channels. As you can see in the picture above, they are using laser treatment to form a new opening in the iris so that way fluid is able to flow out.
Hi, this is Trianna Kubanik speaking. Primary open-angle glaucoma is the most common form of glaucoma affecting nearly 3 million Americans. The entrance of drainage canals are clear. Obstruction is happening further inside the canal. It usually develops slowly over time. There are no symptoms or early warning signs and no noticeable sight loss for primary open-angle glaucoma. The symptoms with advanced progression of the disease include peripheral vision loss and tunnel vision. This type of glaucoma responds well to medication, especially when it is diagnosed and treated early.
Okay, I'm Savana Saenz. I'm going to be talking about acute angle closure glaucoma. This form of glaucoma is a medical emergency and requires immediate intervention. If left untreated, it causes irreversible blindness. This is caused by a sudden rise in intraocular pressure or prolonged pupil dilation. And in this little picture we have a healthy eye at the bottom, and at the top is a eye with acute angle closure glaucoma, just so you guys can see the difference. Symptoms include hazy or blurred vision, severe eye and head pain, nausea, vomiting, sudden sight loss, and they usually happen very quickly and it's very noticeable. To treat acute angle closure glaucoma, the only things that will really help to treat it are medications that will lower your intraocular pressure or emergency surgery.
Okay, so now that we have completed our presentation, let's test your knowledge with the same questions we gave you in the beginning. I'll give you a few moments to answer, and then I'll provide you with the correct answers. Okay, here are the answers. Hopefully everyone got 100. If not, please let me know what we could have done better to help you understand and could have gotten the correct answers the second time around. Thank you all so much for attending our presentation on glaucoma today. We really hope we were able to answer all of your questions that you had.